All right, so today we're diving into some pretty intense stuff. We got an article about MAiD, medical assistance in dying here in Canada, and well, it's tackling some serious misinformation that's been, circulating around.
Yeah, and it's fascinating how this stuff spreads. It often starts with someone with a platform, and in this case, it's a war veteran and public speaker named Kelsi Sheren. She went on Jordan Peterson's show and made some pretty shocking claims about how MAiD is administered.
Yeah, and that's kind of where this article comes in. The author, Paul McGinnis, is a registered nurse
Okay.
who actually specializes in MAiD education.
Well,
So he teaches other healthcare professionals about the process, and he goes point by point in this article and pretty much debunks almost everything Sheren and Peterson said. It's pretty incredible.
it's a good reminder that not all sources are created equal. When we're dealing with complex and sensitive topics like MAiD, it's so important to consider who's saying it, you know?
Right, like what's their background?
What's their expertise?
Exactly.
Yeah.
So let's start with getting to know the key players here. We've got Kelsi Sheren, who, as we mentioned, is a veteran author and public speaker. Then there's Jordan Peterson, a clinical psychologist, and of course have a large following. Both very influential figures, but neither have any medical expertise specifically when it comes to MAiD.
Right. And then on the other hand, you've got Paul McGinnis, our article's author, who is a registered nurse in British Columbia with a focus on MAiD education. So, he's dealing with this topic day in and day out.
Okay, so let's dive into one of the most shocking claims Sheren made on Peterson's show, and that is that people who choose MAiD essentially drown to death because of the medications used.
Yeah.
I mean, it's a pretty disturbing image.
Yeah.
And it's totally understandable why people would be concerned about that.
Yeah, and it taps into like a primal fear. Just a very distressing picture of what's supposed to be a carefully considered medical procedure.
And it gets even crazier because it turns out that this whole drowning claim originates from an anesthesiologist, a Dr. Joel Zayvut, who testified before a Canadian Senate committee about MAiD.
Okay.
Now, Dr. Zayvut drew this comparison from his experience reviewing autopsies of people who were executed by lethal injection in the United States. He observed that their lungs were full of fluid and basically concluded that they had drowned.
Interesting. And so he's trying to kind of apply that to...
He's trying to apply that observation to the Canadian MAiD process just because both involve, medications that lead to death.
Right. So just because they both achieve the same outcome, they must be doing it in the same way.
Exactly. Like McGinnis makes this analogy in the article. It's like saying Tylenol and aspirin must have the same side effects just because they both relieve pain.
Right.
You know what I mean?
Yeah. Hold it.
So the medications used in American executions and Canadian MAiD are totally different. They might achieve that similar outcome, death, but the way they work is completely different.
The mechanisms are very different.
So let's look at the evidence, right? Does it actually support this whole drowning claim? McGinnis actually spoke to another anesthesiologist, Dr. Frucci, who has extensive experience with the medications used in MAiD.
Okay.
And Dr. Frucci was basically like, no, none of these drugs would be expected to cause what's called pulmonary edema,
Oh, okay.
which is that fluid buildup in the lungs.
So no fluid buildup.
Right. McGinnis also highlights these rigorous assessments that are done on lungs that are actually donated after MAiD.
Oh, wow.
Some people choose to be organ donors even after choosing MAiD, which I think speaks to the peace of mind they have with the process.
Right. Yeah, absolutely.
But these lungs go through incredibly detailed inspections. So doctors perform bronchoscopies, which means they use a tiny camera to look directly into the airways. And then they also often use a technique called EVLP, which stands for ex vivo lung perfusion.
Wow, I'm not going to remember that.
Right. It basically means they're assessing the lungs outside the body so they can really get a good look at them.
Oh, okay.
And there's actually research on this, too.
Okay.
There's a study by Watanabe and colleagues that found that lungs from MAiD donors are comparable to lungs from other donors.
So basically they're saying that those lungs are healthy and that they wouldn't be healthy if the person had drowned.
Exactly. So not only do we have these expert opinions refuting the drowning claim, but we also have solid scientific evidence that contradicts it.
Yeah. So it's like double whammy against that claim.
So I think maybe this is a good time to take a step back for a second
Okay.
and clarify exactly what medications are used in the standard MAiD procedure and how they work.
Yeah, for sure, because I think there's a lot of misunderstanding around that.
So the first drug that's given is midazolam,
Okay.
and that's commonly used in hospitals and palliative care to reduce anxiety and just kind of induce relaxation. It's like a stronger version of medications like Valium or Xanax.
Oh, okay.
Gotcha. The next one is propofol, You might recognize this one from surgeries.
Yeah.
It's a powerful anesthetic that basically induces general anesthesia, what we often call being put under or knocked out. Now, here's where it gets important. The dose of propofol used in MAiD is much higher than what's used in surgery.
Oh, really? Okay.
And that's where a lot of people, I think, might go, wait a minute, isn't that dangerous?
Yeah, right. Like we hear about overdoses and stuff.
Exactly. And that's why it's important to look at the evidence. The thing about propofol is that it doesn't just make you unconscious.
Oh.
It induces a deep, deep medical coma where you're completely unaware of anything.
Wow. Okay, so it's not like falling asleep where you could be disturbed or feel pain.
Exactly.
Mm.
So with this dose of propofol, the patient wouldn't be aware of anything. Their blood pressure might drop,
Oh, wow.
but they wouldn't experience it.
That's pretty wild.
That's actually quite reassuring,
Yeah.
Even though the dose is high, it's specifically calculated to make sure that death is peaceful and painless.
Oh, okay. That makes sense.
And in a lot of cases, the patient actually stops breathing on their own just after the propofol is administered. However, just to be extra certain, there is a third medication that's given.
Oh, okay. And what's that?
That is called rocuronium. It's a neuromuscular blocker that paralyzes the muscles, including the diaphragm, which is the one that controls breathing.
Wow. So even if there was any chance they were still breathing, that drug ensures breathing stops completely.
Exactly. And it's important to remember that this medication is used all the time in hospitals, like, for example, during intubation before surgery.
Yeah, that makes sense.
And patients don't experience any discomfort or awareness under these effects of propofol and rocuronium.
Okay, so it's just part of the normal process.
So to recap, we've got nidalolam for relaxation, a high dose of propofol to induce that deep coma, and rocuronium to stop breathing. Is there anything else?
There's actually an optional fourth medication called bupivacaine. It's a local anesthetic, and it's administered if the patient's heart hasn't completely stopped after the other medications, but it's not typically needed.
Okay. So the whole MAiD medication process is designed to first relax the patient, then induce a deep coma to make sure they're not aware of anything, and then the medication stops their breathing.
Yeah. So it's a very carefully chosen combination of medications and given in a specific order to make sure that MAiD is, a medically sound and humane procedure, far from that like disturbing picture that the misinformation paints.
Yeah. Well, that was a lot to process.
Yeah.
But I think we definitely debunked that whole frightening, drowning claim.
Yeah, for sure.
But I know Sheren and Peterson made a lot of other statements about MAiD in that video.
Oh, yeah, they did. They touched on everything from supposed agendas to the government supposedly offering MAiD as a cost-saving measure. Yeah, we got a lot more to unpack.
And I'm ready for it. Where should we head next?
Well, I think a good place to start is with Sheren's claims about the motivations behind MAiD in Canada. So she suggests that there's this agenda at play, and she uses terms like MAiD people
Ooh, yeah.
to kind of imply some sort of coordinated push for its expansion. And she even goes so far as to accuse the government of promoting MAiD to save money.
Yeah, that MAiD people thing really struck me as odd.
Yeah.
It's almost dehumanizing, isn't it? Like, it's this
Yes.
faceless group
Yeah.
with this, like, singular and, potentially sinister motive.
Right. And you've hit on like a key point there. McGinnis actually addresses this in the article and argues that reducing people to a label like that, MAiD people, ignores the nuance and the complexity of the issue, and that most people who support MAiD actually fall somewhere along a spectrum of beliefs and not at some like radical extreme.
So what does that middle ground look like then? Like, what are people advocating for when they talk about expanding access to MAiD?
I think it really boils down to respecting individual autonomy and the right to make informed decisions about one's own death, especially in the face of like unbearable suffering. It's not about encouraging or pressuring people towards MAiD, but about ensuring that it's available as an option for those who meet the very strict criteria and freely choose it.
Okay, that makes sense. Let's talk about this claim that the government is pushing MAiD as a way to save money. Sheren specifically mentions that in 2021, MAiD saved the Canadian healthcare system $86.9 million.
Right. And, it's important to understand the legal and financial context of MAiD in Canada here. So first of all, MAiD isn't some government initiative that they, dreamed up and implemented. It actually became legal because of a Supreme Court ruling that found that the previous laws prohibiting assisted dying were unconstitutional. So the government was legally obligated to create legislation that would allow MAiD while incorporating safeguards to protect vulnerable individuals.
So it wasn't a matter of them, like, choosing to do it. They were compelled to.
Exactly. And second, while the criminal code governing MAiD is federal, healthcare delivery itself is primarily a provincial responsibility.
Okay.
So even if there were cost savings at the federal level, they would be minimal.
Okay, that makes sense.
Yeah.
Sharon also seems to be implying that MAiD is kind of like replacing palliative care, that people are being pushed towards MAiD instead of being offered palliative care options.
Yeah, and that's actually a dangerous and inaccurate misconception.
Ah.
Offering palliative care is actually a mandatory part of the MAiD assessment process.
Right.
Yeah. Assessors are legally obligated to make sure that patients have been informed about and have considered all available means of relieving their suffering, and that includes palliative care.
So someone couldn't just decide they want MAiD and then just immediately get it. There's a process to make sure that they've explored all their options.
Absolutely. In fact, statistics show that a higher percentage of people requesting MAiD receive palliative care compared to the general population of, dying Canadians.
So it's actually the opposite of what she's suggesting. It's like
Yeah.
people are more likely to choose MAiD after exploring palliative care.
Exactly. And it reinforces this idea that MAiD is about providing choice, not replacing other forms of care.
Okay, yeah. I want to circle back to something Sharon said earlier about there being like a 30% increase in MAiD cases since 2022. It seemed like she was using this to suggest that MAiD is kind of like spiraling out of control.
Yeah. And again, it's important to be cautious about how statistics are presented and interpreted. While the numbers she cites for 2021 and 2022 are accurate, the 30% increase since then simply isn't verifiable. The most recent data from Health Canada is from 2022. It's unclear where she's getting that 30% figure from.
And she also mentioned a high rate of MAiD happening in British Columbia. Is there any truth to that?
British Columbia does have data available for 2023, and it shows an increase in MAiD deaths. But it's a 10% increase, not 30%. So again, it's about being critical of the numbers.
So just because the number of MAiD cases is increasing, it doesn't necessarily mean that there's a problem.
Exactly. The crucial question is whether the increase aligns with the eligibility criteria and whether the safeguards are working as intended.
Okay.
Yeah.
There's one more claim I have to ask you about. Sharon makes this statement about children being on the chopping block.
Ooh.
And she claims there was a bill that would allow 17-year-olds to access MAiD. What's the truth about that?
That's a particularly inflammatory and unfounded claim. There is currently no legislation in Canada that allows minors to access MAiD, and there hasn't been any serious proposal to change that.
So what was she talking about?
It seems like she's referring to Bill C-39, but she's totally misrepresenting it. That bill actually extended the exclusion of people with a sole diagnosis of a mental disorder from accessing MAiD. It had nothing to do with minors.
It's amazing how much misinformation can be packed into such a short video.
It's really incredible.
It seems like she just took a few snippets of information, often out of context, and then twisted them to fit a very specific narrative.
Yeah, and it really highlights how crucial it is to go back to the source material, check the facts, and really verify claims, especially when they evoke such strong emotions.
I'm feeling a little overwhelmed by all this, to be honest.
Yeah.
But I really appreciate you breaking it down so clearly.
Oh, yeah, of course.
What else is there to uncover in this article?
Sharon made some pretty alarming claims about veterans, being offered MAiD, implying they were being pressured into it.
Yeah, that's a serious accusation. Does McGinnis address that in the article?
He does. He actually mentions a case where a Veterans Affairs Canada caseworker inappropriately offered MAiD to several veterans.
Oh.
And he calls it appalling, and I think most people would agree with that.
So he acknowledges it did happen.
Yes, but he also provides some important context. While offering MAiD in that way was undeniably wrong, healthcare providers do have a responsibility to inform patients about all available options, including MAiD, especially when they're discussing end-of-life care.
Right.
So it's a delicate balance,
It's like you don't want to pressure someone, but you also want to make sure they have all the information they need to make an informed decision.
Exactly. And there are guidelines from Health Canada about when and how to discuss MAiD with patients. It should be done with sensitivity and only when appropriate.
So it sounds like this VAC caseworker really messed up.
Yeah.
But does that mean that veterans are being pressured into MAiD? Surely there are safeguards in place to prevent that.
You're right. MAiD assessors have a legal obligation to ensure that requests are voluntary and free from any external pressure.
Okay.
And they're required to document how they determine the request was freely made.
So even if someone was inappropriately offered MAiD, they wouldn't actually be able to receive it unless they genuinely met the criteria and wanted it.
Precisely. And this emphasizes that while the way MAiD is discussed is critically important, there are robust safeguards in place to protect vulnerable individuals.
What else is there to uncover in this article?
Well, there are a few more points to address, including Sheeran's mention of the Delta Hospice Society and how confirmation bias might be influencing her interpretation of information. Are you ready to keep digging?
Absolutely. Let's get to it. Okay, so you mentioned the Delta Hospice Society. I'm curious about that. Towards the end of the video, Sharon said one of their hospices was shut down because they refused to offer MAiD. What happened there?
Yeah, it seems like she's referring to the Irene Thomas Hospice in Delta, British Columbia. It was operated by the Delta Hospice Society and funded by the Fraser Health Authority. And yeah, they did lose their funding because they refused to allow MAiD to be provided at the hospice.
Why, though? Aren't all healthcare facilities required to offer MAiD?
Oh, it's not quite that simple. In British Columbia, some religious healthcare facilities are exempt from providing MAiD, based on an agreement with the province. However, the Delta Hospice Society, they weren't a religious organization.
So they were publicly funded but wanted to dictate which services they would and wouldn't provide.
Essentially, yeah. And in the end, Fraser Health took over the operation of the hospice to ensure patients had access to MAiD if they chose it.
It's an interesting situation for sure. Balancing individual beliefs with, the obligation to provide legally mandated healthcare services.
Yeah, very complex issue.
You know what I find interesting is how Kelsi even learned about this whole situation. She mentions finding out about it from a friend's mother who attended some event, and this comes right after she admitted to just learning about the drowning claim the day before from a 2021 Senate hearing report.
Yeah, it sounds like she's kind of latching on to any information that supports her existing beliefs about MAiD, even if it's years old or comes from, questionable sources.
It really makes you think about how much of what we see and hear is actually based on verified facts versus, just echoes of information that fits a particular narrative.
That's such a crucial point. And it's not just about Kelsi, It's a reminder for all of us to be aware of how our own biases can shape how we interpret information. We need to be critical thinkers, question our assumptions, and be willing to consider evidence that challenges our preconceived notions.
Well, we covered a lot of ground in this deep dive. We went from this disturbing image of drowning to death to, a clear understanding of this carefully considered medically sound procedure. It's clear that there's a lot of misinformation about MAiD out there, and it can be easy to get caught up in, fear and strong opinions.
Yeah, and what's concerning is that this misinformation can actually have a real impact on people's decisions about their end-of-life care.
Right.
Having access to accurate, evidence-based information is crucial so people can make informed choices that are right for them.
For me, this whole deep dive has really underscored the importance of critical thinking. Like, we really need to scrutinize information, especially what we encounter online, and be willing to, really dig deeper for the truth.
Absolutely. It's such a vital skill in today's world where misinformation spreads so easily. This whole deep dive into MAiD also raises a broader question. The article really focused on debunking these false claims about the process of MAiD, but what about the ethical considerations surrounding it? What are your thoughts on the ethics of MAiD in general? It's a complex issue worthy of, careful reflection.
That's a conversation we can have for hours. And honestly, it's something that I think everyone should be thinking about as MAiD becomes, more prevalent in Canada. It's about having open and honest conversations, respecting different viewpoints, and ultimately, making informed choices that align with our values.
Yeah, well said. Knowledge is empowering, but it's up to each of us to seek out those reliable sources and really engage in that critical thinking to, navigate all the complexities of the world around us.
And on that note, we'll wrap up this deep dive. Thanks for joining us as we explored the sometimes murky waters of misinformation surrounding MAiD. Until next time, stay curious and stay informed.